Government health experts made a controversial recommendation today about the vaccine for the human papillomavirus, or HPV. Routine vaccinations are already recommended for girls beginning at age 11, but today the federal panel said that boys should be vaccinated for HPV as well. We asked Dr. Jon LaPook to look into this.
Susie Silver was ahead of the CDC recommendation. Last year, she made sure her son Bennett got his first HPV vaccine when he was 12, and her reasons were clear.
Making sure that he's safe, making sure that the women that he's with in the future are safe.
HPV is spread through sexual contact and is linked to cancer. The vaccine is effective in preventing cervical cancer in females and anal cancer and genital warts in both sexes. Dr. Joseph Piccini chairs the HPV panel.
And by adding vaccination for men, we reduce the burden of disease both in men and in women because we expect to reduce the transmission both ways.
Gardasil, Gardasil, Gardasil.
While the data shows the vaccine is effective, it has remained a tough sell. Just 32% of girls completed the required doses last year. Cost is one concern, $390 for the 3-shot series. Safety is another, despite assurances from the CDC.
This vaccine is safe. The evidence is that it's effective, and so we haven't learned any significant abnormal effects since the introduction of the vaccine.
Still, mothers like Shoshana Blasco aren't sold. She feels young boys don't need a vaccine against sexually transmitted diseases.
I'm very uncomfortable giving it to my children.
And her 14-year-old son, Evan, agrees.
12-year-olds aren't going to be having sex, so there's no point to get the vaccine.
But Scott, this is exactly the reason why experts argue that kids should get it earlier before sexual activity and before they develop these diseases like cancer and genital warts. Now, for the future, another important thing is that the earlier this vaccine is given, the better the protection, the better the immune response, and the better they're going to be protected against these diseases in the future.
Doctor, thank you very much.